Hey everyone, and welcome. So, if the thought of administering enteral nutrition feels a little daunting, don't worry. You are definitely in the right place. Today we're going to break this essential skill down piece by piece so you can walk onto the clinical floor and into your exams feeling totally confident. Okay, so here's our game plan. First, we'll cover the basics. Then we'll dive into the safety rules you absolutely cannot forget. After that, it's the full step-by-step procedure, followed by what to do when things don't go as planned. And we'll wrap it all up with a super quick review to get you prepped for the NCLEX. Let's jump in.
All right, first things first. Before we get into the how, we've got to be crystal clear on the what and the why. Let's build that solid foundation.
So, here's the key concept to lock in. The gut works, but the patient just can't eat or drink enough on their own. That's it. We're not bypassing their digestive system, we're actually using it. Think of it like we're just creating a new temporary entrance for food to get where it needs to go.
Now let's look at the hardware. You've got your temporary tubes, the ones that go through the nose, like an NG tube, and then you have your more long-term, surgically placed tubes, like a G tube. And how do we deliver the food? Well, we've got two main methods. A bolus feed, where you give a set amount pretty quickly with a syringe, or a slower drip from a feeding bag, which can be intermittent or run continuously. Okay, let's pause here because this next part is, without a doubt, the most important section. Before we even think about touching that formula, we have to talk safety. These are the critical checks that you do every single time to prevent serious errors.
So that leads us to a really important question, one you need to know the answer to in your sleep. What are the absolute worst-case scenarios? What are the biggest dangers we are trying to prevent with all these safety checks?
This right here is the #1 never event. Accidentally hooking up a feeding tube to an IV line is a catastrophic mistake. It's why we are so strict about our protocols and why you can never, ever get complacent with this skill. So, these 4 rules need to become second nature, just like breathing. 1. Always verify your patient with 2 identifiers. 2. Always check for allergies. 3. Label all your tubing so no one can ever mistake it for an IV line. And 4. Never ever mix meds directly into the bag of formula. It can cause clogs or mess with the medication itself.
All right, now that we have that critical safety foundation set in stone, let's get into the actual procedure. We're going to walk through this step by step, breaking it down into 3 simple phases: prep, placement check, and then the feed itself. You know, the procedure really starts way before you even touch the patient. It starts with you in the chart, double-checking the doctor's order. Then you're washing your hands, gathering all your supplies. You walk in, you use your 2 patient identifiers, you explain what you're doing, and then, this is huge, you do a quick GI assessment. You're listening for bowel sounds and checking for any abdominal distension. If something feels off, you stop and you call.
Okay, everybody, listen up. If you only remember one thing from this whole explainer for your NCLEX, make it this. Elevate the head of the bed to at least 30 degrees, but 45 is even better. This is your #1 defense against reflux and aspiration. It is absolutely non-negotiable. Okay, so the patient is positioned correctly. What's next? We have to confirm that the tube is in the stomach and not down in the lungs. We always use at least 2 checks. The gold standard before every single feeding is pulling back some of the stomach contents. You're looking for a grassy green or tan color, and when you test it, the pH has to be acidic, 5.5 or less. And you're also checking the marking on the tube outside the nose to make sure it hasn't moved. Now you've got a choice to make, and it really depends on the patient. For stable folks who can handle it, a faster bolus feed with a syringe works great. But for patients who are more critically ill or have a sensitive stomach, a slower, continuous feed using a bag and a pump is usually the way to go because it's just gentler on their system. And now for the main event. Just remember this simple mantra: flush, feed, flush. You flush with about 30 to 50 milliliters of water first to make sure the tube is open. Then you give the room temperature formula. And when you're done, you flush again to clear the line. And just as important, the patient has to stay sitting up for at least 30 minutes afterward. Then you do your final safety check, call light in reach, bed low, and you're all set.
So in the real world, things don't always go by the book, right? Stuff happens. So what do you do when you run into a problem? Let's talk about how to troubleshoot the most common issues you're going to see. Think of this as your quick reference guide. If the tube feels clogged, first try a gentle flush with warm water. And please, don't use cranberry juice. That's an old myth. If you see signs of aspiration, coughing, choking, your immediate action is to stop the feed. That's priority number 1. And if the patient feels nauseous or is cramping, your first move is to slow down or just stop the infusion. Act fast, keep them safe, and then call for help if you need it. Whew, okay, we have covered a lot of ground. So let's bring it all home and boil it down to the absolute must-know highlights. This is the stuff you want to have memorized for your exams and for your very first day on the job.
Let's run through this rapid fire. 1. Head of the bed up, always. 2. Check that placement with pH before every single feed. 3. Remember the mantra, flush, feed, flush. 4. Formula should be room temperature, not cold. And 5. Super important for bolus feeds. Let gravity do the work. Never ever push the plunger. If you can nail these 5 points, you're going to be in great shape.
And hey, to help you really crush those exams, we've put a list of our absolute favorite NCLEX prep books in the links down below, so be sure to check those out. And if this explainer helped clear things up for you, it would mean the world to us if you'd hit that like button, share it with a classmate, and subscribe for more nursing explainers just like this one.
And I want to leave you with this one last thing to think about. Knowing the steps is the science of nursing, and it's vital. But what really makes a nurse incredible is the art. How can you use this routine task to connect with your patient, to offer a moment of comfort, to make them feel seen? That's what it's all about. Thanks so much for watching.